Hello, everybody. Good afternoon. Thank you, everybody, for joining us today. We're so glad you're here. Before we get started, we wanted to note just a few housekeeping points to avoid background noise. All participants will be muted for the duration of the webinar. We will be addressing questions at the end of the webinar. If you have any questions as the webinar continues, please enter them into the question box, which is located on the right-hand side of your screen. If viewing from a computer, or at the bottom of your screen if you're viewing from a phone. If you have any comments and concerns during the webinar, please also enter those into the question box, and we will review them and address them any immediate needs as they occur. A recording of this webinar will be emailed to each registrant tomorrow. The recording will also be available on our website at www.namimd.org for any individuals that were unable to register. After the webinar today, you will be asked to complete a short survey on the aspects of this webinar that you felt were helpful or could be improved, and what would you like to see in the future webinars. We plan to continue hosting educational webinars, and we ask that you please fill out the survey to let us know how NAMI Maryland can best support you during this time. I now hand it over to our moderator, Gertie.
Hello, everyone. Thank you for attending. I'm Gertie Wilson. I'm a former board member with NAMI Maryland, and I will be the moderator for today's webinar. Today, we're hosting Hilary Wiseman, who will provide information on accessing services and resources through the VA Maryland healthcare system, with a focus on the Caregiver Support Program and safely aging in place. The VA Healthcare Administration offers a wide variety of ways to support both veterans and their caregivers as they move through their healthcare journey. Information provided in this presentation will provide guidance on accessing care, contact information for relevant services, benefits, and additional resources to help meet the needs of our veteran community. CEUs are not provided for today's webinar, but a certificate of attendance will be sent to each registrant participant tomorrow afternoon. Welcome, Hilary. Hilary Wiseman is at MPH LCSW-C. You all know those initials. It came to social work by way of teaching and curriculum writing. She received her MSW from the University of Maryland School of Social Work and her MPH from Johns Hopkins University, with a focus on behavioral health science. Hilary spent both her VA social work internship and her first 3 years at the VA Maryland healthcare system, working as a primary care social worker, serving several specialty primary care teams, as well as covering the emergency department for non-mental health related needs. Hilary moved to the Caregiver Support Program and began coordinating the program of General Caregiver Support Services since January of 2020. In her role in the Caregiver Support Program, Hilary routinely provides education and outreach to the community and VHA staff. She develops and implements programming, a variety of programming for caregivers, including one-on-one coaching. Hilary is a lifelong learner with a passion for education and information, sharing with a dedication to highlighting the crucial role caregivers play in caring for our nation's veterans. Thank you for joining us today, Hilary.
Thank you so much. Can everyone hear me? Yes, okay. I'm hoping that my slides are going to come up in just a second. So first, I just want to start out with the slides are going up of just saying thank you so much for having me today. It's a pleasure to be with all of you. Happy National Family Caregiver Month to any of you in the audience who are caregivers. And I want to recognize that tomorrow is Veterans Day. So for any veterans that are here, thank you so much for your service. I'm going to go over lots of information today. If I'm being honest, I could probably spend an hour on every single slide I'm going to talk about. So we're going to move a little bit fast, but I'm hopeful that the information that we've provided to you here in this webinar will give you kind of a place to come back to revisit information and follow up as needed. So we can go to the next slide. If we want to go to the next slide, there we go. Okay, so just a few reminders that this presentation is really meant to provide general information about services and supports available through the VA Maryland healthcare system. Available services and eligibility criteria may vary by VA and are subject to change. When there are aspects that are kind of national programming, I'll try to let folks know that. I encourage you to put questions in the chat. I have the questions that were put in as part of the registration process here. So I'm going to try to hit those as we kind of move through the presentation. So the very first thing I like to talk about when it comes to eligibility, when it comes to VA healthcare services, is starting with eligibility. So who is eligible for VA health services and how do you get eligible? So the biggest takeaway from this slide is that eligibility into VA healthcare does not happen automatically. There's not an automatic enrollment process for veterans. Veterans have to, take active steps to enroll in VA healthcare. That can happen over the phone, by mail, online, or in person. I've included our eligibility website as well as the way to apply for healthcare, our national enrollment office, as well as our local enrollment office. One thing I would just note is that if you are a veteran or the caregiver of a veteran who has ever been told that you are not eligible for VA healthcare due to your income, I would suggest that you get in contact with your local VA's enrollment office and social work department and talk to them about if something called catastrophic disability might be appropriate for you. If you're a veteran who has been told you're not eligible for VA care based on income, but you do have significant health care needs, catastrophic disability may assist you in becoming eligible. I know that this was one of the questions that came up. I'm not going to get into the exact eligibility criteria. We have a whole department who specializes in that. But again, the highlight here is that if you are a veteran, I highly encourage you to take the steps to enroll in VA healthcare and follow up with either our local or national contacts to do so. We can go to the next slide. So one of the things that folks have access to once they become eligible for VA healthcare, and this is something every veteran who enrolls in VA healthcare has access to, is primary care, or PACT. So the government loves an acronym. PACT stands for Patient Aligned Care Team. That is the VA's version of primary care. The VA has primary care clinics at our medical centers as well as our community outpatient clinics. We also have home-based primary care in certain geographic locations for veterans who are homebound and unable to leave their home. There are specialty primary care clinics, like our clinic that serves our veterans who are experiencing housing instability, our veterans who have more severe mental health needs, our older adult veterans. We have a comprehensive women's health clinic. I mentioned home-based primary care, and then our ID or infectious disease primary care clinic, which is focused on providing care to veterans who live with chronic infectious conditions. One really big highlight about primary care, and I personally think one of the best things that the VA has to offer, are primary care social workers. So there is a primary care social worker who is attached to every primary care team within the VA. You may think, I have a primary care doctor and I've never talked to them. I don't have a primary care social worker. It might be true that you've never talked to that person, but they are there and they are available to you. Those folks are really excellent at helping with care coordination needs, with system navigation needs. They're also going to be the main point of contact if you have had to receive emergency care in the community and have been hospitalized and might need some assistance coordinating care after your stay at that hospital. Primary care social work will be your point of contact. I would encourage every veteran or caregiver of a veteran who's here at your next primary care visit to ask your primary care doctor who your primary care social worker is and how you would get in touch with them if needed. Again, locally, I've provided some information here. If you're wondering how to find the nearest primary care clinic to your home, you can use the Find Locations tool, and I've included that website on this slide as well. You can go to the next slide. Again, that's just another note on primary care social work. We're fine to stay here. So again, those primary care social workers, they're going to be available for those brief solution-focused issues. They're not able to provide ongoing case management, but they are your point of contact if you need assistance with care coordination or system navigation, or if you need assistance getting connected to community resources in areas where the VA is unable to assist. One of the reasons why primary care or PACT is so important, and the reason why we encourage all veterans to see their primary care providers at least one time per year, is so that you remain active with that primary care provider, and particularly important so that if there was an urgent situation, let's say that care coordination example following a community hospitalization, the VA has to have a VA primary care doctor that you're connected to within the system who they can coordinate your care with. Connection to primary care is also required for some specialty care services, as well as for referral to our geriatric and extended care services, including our home health aides, which we'll talk about in another few steps. Another thing that is important about primary care is that the VA, if you would like to have your prescriptions filled by the VA, we don't operate as a kind of a Walgreens or a CVS where you can just kind of bring your prescription to our pharmacy and they'll fill it for you. Those prescriptions have to be entered into our system by a VA provider, and for most people, that's their primary care provider. So again, if you're looking to have the VA fill prescriptions for you from the outside, connection to your primary care doctor is going to be very important. The VA does welcome folks to continue to work with primary care providers in the community if they would wish. The one area in the VA Maryland system where this is a little different is for home-based primary care. If veterans are engaged with home-based primary care, then we do ask that we're the only primary care provider. So the highlight here is make your primary care appointments. Make sure you're seeing that primary care provider at least one time per year so that in the event of an emergency, you have all of the resources that the VA can offer you at your disposal. You can go to the next slide. So I mentioned before that primary care is important because it can help connect you to geriatric and extended care services. This is one of the slides and information that I think is really important for our veterans who are working to safely age in place as they get older. We have an adult day care service where we contract with adult day centers in the community, and the VA is typically able to assist with paying for 2 days a week of those services at that adult day center. That can be super important for veterans who might be looking for an environment to get some socialization, to address isolation, and it can also be an incredible respite benefit for our caregivers. If their veteran is able to attend an adult day center for 2 days a week, that provides that caregiver with 2 days that they're able to address their own care needs, able to take care of household tasks without having to also care for their veteran and care for themselves. So adult day healthcare centers can be a big part of taking care of yourself as a caregiver as well. The home health aid program is an incredibly popular program for great reason. It allows us to provide in-home supports to veterans who need assistance with activities of daily living. So if you are a veteran or if you're caring for a veteran who needs assistance with things like bathing, dressing, grooming, toileting, mobility, or transferring, those personal care items, and you need hands-on assistance to do those tasks safely, a home health aide might be approved for you. Typically, we provide about 10 hours of in-home assistance from those aides. So the way that it works is that the VA contracts with a number of agencies in the community. We would assign you an agency, and then you would work with that agency to be assigned an aide and on the scheduling. The one thing I really want to highlight here is that home health aid services through the Maryland VA healthcare system are focused on providing personal care services for those activities of daily living, the bathing, dressing, grooming, toileting, transferring, and mobility. Our home health aides are not able to provide assistance in the areas of cleaning or laundry or meal preparation or skilled care, or like medication reminders. I recognize that those are incredibly important aspects of staying safe in your home, but unfortunately, those are not things that the VA is able to assist with. And then respite care is also a really important component. The VA does have both inpatient and in-home respite care. Your ability to access inpatient respite care is dependent on if you are service connected. We're going to get to a slide about service connection, but the highlight with that is that it has to be something that the Veterans Benefits Administration has advised that you are considered service connected and at what percentage. So our veterans who are 70 to 100% service connected are eligible for inpatient respite, meaning they would come into one of our long-term care facilities for a short-term stay. Or folks might just be looking for in-home respite, which is kind of an extension of those home health aide hours. Again, for caregivers who might be in the audience, engaging in routine respite care can be an incredibly important and impactful way to help care for yourself. Giving yourself those times and spaces to take a break, to care for yourself, to address your own healthcare needs or needs that other family members might be having can go a long way in helping to reduce caregiver stress and burden. And then again, there's the website for additional information on geriatric and extended care through the VA on this slide if folks are interested. And we can go to the next slide. So durable medical equipment and home modifications. This is another space where, in my opinion, the VA really excels at what we're able to provide to people. So the vast majority of durable medical equipment that is provided through the VA is going to be done at no cost to the veteran. That can be something as big as a hospital bed or a Hoyer lift, and something as small as a handheld urinal to put by the bed or a shower chair. Or a raised toilet seat or a grabber. The highlight with durable medical equipment and the VA is really that the VA does not reimburse. So if you go out and you buy the, you buy the equipment that you feel like you like or you need, that's great, but the VA is not going to be able to reimburse you for that. If you would like to get durable medical equipment through the VA, you need to work with your VA providers to have those requests put in. Some durable medical equipment requests will require additional assessment from an occupational therapist or a physical therapist, depending on their request and the needs. The VA does also have a program called the HISA grant, or Home Improvement and Structural Alterations. This grant is available to help folks make improvements or alterations to their home to improve accessibility. So most popularly, this is used to help folks transition from having a bathtub in their bathroom to a roll-in walk-in shower, or opening up doorways so that power wheelchairs will fit through, things of that nature. But again, the highlight here is that if you're in need of durable medical equipment or a home modification due to your conditions, talk to your VA providers first and see if it's something that the VA might be able to provide to you before going out of pocket for it. We can go to the next slide. So just a couple of additional resources I always like to make sure to mention. My Healthy Vet, this is our way, it's kind of our system for veterans to be able to have access to their own medical records. You can use My Healthy Vet to access records, to send secure messages to your providers, to request prescription refills, things of that nature. So that slide includes the link to My Healthy Vet. I want to highlight Patient Advocate. So the VA, just like any other system, isn't always perfect. And so if you're a veteran or a caregiver who is experiencing frustration around the care that you're receiving, if you've had an experience with a VA staff member that you don't think is kind of up to the level of service that should be provided, I strongly encourage you to contact the patient advocate at your site. Contacting the patient advocate will allow that advocate and the advocate's office to address your concern, to follow up with you about your concern, but it also is kind of the place where the larger system can become informed of issues that are coming up and take action. Advanced directives are a big thing that we always talk about with veterans, and particularly as we get older. The VA does have its own advanced directive document that can be used by veterans to determine who they would like to be their healthcare decision maker if they're unable to make those decisions for themselves, as well as to talk about what life-sustaining treatment they would want to be provided. Veterans have the option, they're certainly welcome to use our forms, but if veterans have advanced directives that have been established outside with legal professionals or using other documents available, that's okay. We will accept those as well. The big note is that if you have an established advanced directive, we would highly encourage you to provide your VA with a copy of that advanced directive. And if you don't have an advanced directive, but you're interested in establishing one, again, contact your VA providers and ask them. Many VAs have even a program that's available where you can kind of meet in a group setting with other veterans and a facilitator to kind of talk about advanced directives and why it can be an important step in someone's healthcare journey. And then last, I always like to mention aid and attendance, and I bring up aid and attendance for two reasons. One is because aid and attendance is a financial benefit that is available through the Veterans Benefits Administration and is primarily for veterans who are at a place in life where they require extra care, the assistance and attendance of another person. The aid and attendance benefit does also look at the veteran's financial situation in order to see if they would qualify for that benefit. And again, that's all going to go through the Veterans Benefits Administration. So again, there is income criteria that they look at, as well as service date criteria, as well as clinical criteria. The other reason why I like to highlight aid and attendance is because years ago, I became aware that there are community agencies who are unfamiliar with aid and attendance and are giving some information out to the community that's not entirely accurate. So if you've talked to someone and if you've talked to a private agency and they have asked you to pay them for assistance with applying for aid and attendance, or if they've advised that you are required to identify an aid or a third party that money is going to, neither of those things are true or necessary. So please get in contact with your local VA and your VA provider or the Veterans Benefits Administration or Veteran Service Officers for additional information about aid and attendance if you need it. We never want to see veterans or their family members paying someone for information or assistance with applying for benefits. And we can go to the next slide. So I wanted to make sure that because I was coming here to talk to NAMI and NAMI's audience, that I also spent a little bit of time just reviewing the mental health resources that are available through the VA. So this is talking specifically about what's available to veterans. So we have our general mental health services, as well as a long list of specialty mental health services. Some veterans are also eligible to receive mental health care through their local vet centers. If we go to the next slide, you'll see some great information, not only about connecting to our local here in Maryland, to our local mental health resources, but also some great apps that the VA has put out and are available around mental health. Our VA mental health website has tons of information. The VA has several different suicide prevention resources out there, as well as materials. So I've provided several of those links, as well as some information on the Compact Act, which has done some work to expand the veterans' ability to access VA or non-VA care facilities during a suicidal crisis. The other big things I want to highlight here, I hope most people on this call aren't a stranger to the crisis line. So we know that number just changed to 988, which is great for me and much easier to remember. One thing I like to highlight is that number is for everyone, our caregivers, anyone here in the audience. And then if you're a veteran and you'd like to connect to the Veterans Crisis Line, you can always press 1 to do so. You can also text them or chat them. So all of that information is there. Another really, I think, special resource that the VA can offer is something called Coaching into Care. And Coaching into Care is a program that's staffed by VA mental health professionals, and they answer the call of family members or friends who might be concerned about a veteran's mental health, concerned that that veteran is not willing to engage in mental health services and need some support around how to have those conversations. Coaching into Care is not accessing veterans' healthcare records. They are not scheduling appointments for veterans without their knowledge. They are simply listening to the information that's being provided by those concerned family members and friends, and then helping those folks to develop the language and plan that might be needed to encourage their veteran into care. So if you know someone, if you know a veteran who is maybe struggling in their mental health and is hesitant to engage in care, I would highly suggest that you contact our Coaching into Care program and get the advice of our professionals on how you might be able to assist them. We can go to our next slide. All right, so I mentioned previously when we were talking about inpatient respite about service connection. So I'm going to pause for a minute to just explain that in a little bit more detail. So service connection is the term used for VA disability compensation or pay. It's a monthly tax-free payment. Veterans can apply for service connections for injuries or illnesses that they incurred during or as a result of their time in the service. So when you're thinking, if you're a veteran who's thinking about if you have any service-connected healthcare conditions, or if you're caring for a veteran and wondering if they might have any service-connected healthcare conditions, one of the things to think about is that it's about if something that happened to them during their time in the service or as a result of their time in the service is causing that condition. Veterans can be service connected for one or more injury or illness. The Veterans Benefits Administration will rate the impact of each one of those identified conditions on a scale of 0 to 100%. And then the Veterans Benefits Administration determines a veteran's overall service connection rating on a scale of 0 to 100%. Veterans can be service connected for physical conditions, chronic illnesses, or injuries. This kind of often looks like what most of us think of when we think of things like that. So that might be the veteran who experiences ongoing knee pain as a result of being a parachuter and jumping out of planes. That might be the veteran who has seen combat and had loss or damage to a limb. So certainly those physical injuries or illnesses could be considered for service connection. Veterans can be service connected for mental health conditions that the Veterans Benefits Administration identifies have been caused or exacerbated by their time in the service. And then veterans can be service connected for conditions that have been that we've identified as being the result of environmental exposures. So this is known as presumptive conditions. Typically, what the example that we use here are our Vietnam veterans who we know were exposed to Agent Orange. And today, with the additional knowledge and education we have, we know that Agent Orange can be connected to a list of healthcare conditions. So that's one example of how environmental exposures can lead to service connection. A popular example that I think all of us have seen too many commercials for on TV has to do with water contamination at Camp Lejeune. So again, another way that we're seeing an environmental exposure that could be could lead to a service connection. A couple of things that are so important to highlight when we're talking about service connection. The only body that can determine what a veteran's service connection is, or if they're service connected and at what rate, is the Veterans Benefits Administration. They are the only folks that can do it. So if you are, let's say, an example, a Vietnam veteran who served in Vietnam and we know was exposed to Agent Orange, and now decades later, you're receiving VA healthcare for prostate cancer. and you're getting all your treatment through the VA for prostate cancer, and you're seeing all your doctors through the VA for prostate cancer. Now, some prostate cancer is linked to exposure to Agent Orange, so that could lead to a service connection. But just seeking or receiving care for a condition will not lead to you being service connected. You have to apply for that condition to be service connected and then have that application reviewed and determined by the Veterans Benefits Administration. Now, this is a lot of work to do, and there's a lot of complicated parts that go into it. But one thing I like to highlight is that you do not need to pay for assistance in filing a service connection claim. Free help is available through veteran service organizations, which have been vetted and trained by the Veterans Benefits Administration. If you or your loved one are considering applying for a service connection or would like to talk to someone more about a service connection, I strongly encourage you to connect with a veteran service organization before you talk to any of these private agencies that are typically charging significant amounts of money. So again, we would absolutely encourage and refer veterans and their families to talk to veteran service organizations if they need assistance applying for service connection or other financial benefits through the Veterans Benefits Administration. We can go to the next slide. All right, and now on to my main topic, and one of the things I'm so excited to talk to you guys about today, which is our VA Caregiver Support Program. So again, I just want to wish a happy National Family Caregiver Month to any of our family caregivers who are in the audience, and then we'll take a look at the next slide. So this slide gives just some statistical information about military and veteran caregivers. So some of the conditions that folks are typically receiving care for. And the slide breaks down kind of the difference between conditions that most post 9/11 veterans receive care for and then pre 9/11 as well as civilians. So if you look kind of at the bar graph on the top right of the screen, we can see that certainly our veteran population typically are particularly with our post 9/11 veterans require a lot more care around traumatic brain injuries than the civilian population does. Vision and hearing problems are much more prevalent as caregiving related needs in the veteran population versus the civilian population. So you can kind of see where veteran and military and veteran caregivers fall as it relates to folks kind of outside of that group. I think it's also really important to highlight this idea that 9% of US adults are caregivers. Talks about that being kind of, you know, millions of civilian caregivers, millions of military and veteran caregivers. The other thing that I like to mention is a quote by Rosalind Carter, which says that there are only 4 kinds of people in this world: those who need a caregiver, those who are caregivers, those who will become caregivers, and those who will require caregivers. So caregiving is going to touch all of us in our lives at one point or another, while we're someone who's providing care or receiving care. Sometimes we're both providing and receiving care at the same time. So I think it's just really important to highlight that caregiving is something that is going to impact all of us in our lives. And if it hasn't yet, it will likely impact you in the future. We can go to our next slide. So the VA does have a caregiver support program. This program was really built to promote the health and well-being of family caregivers who care for our nation's veterans. And we do that through education, resources, supports, and services. One thing I want to say from the very beginning is that caregivers are a crucial part of the VA healthcare system, of our healthcare teams. They are typically the folks who are with their veterans the most, providing their veterans the most care. They are often the hidden heroes, as the Elizabeth Dole Foundation likes to refer to folks, right? Caregivers are an incredibly important part of a veteran's healthcare team. The VA's Caregiver Support Program has 2 programs under one umbrella. I'm going to talk about both of those programs as well as the education and supportive services that the VA has to offer for all caregivers. So I'm going to start actually on the right side of the screen with our program of general caregiver support services. So in a general program, or PGCSS, veterans have to be enrolled in VA healthcare. Their caregiver has to be above the age of 18, but there are no specific clinical criteria that have to be met in order for that caregiver to enroll in our program. We do complete an enrollment process, which includes asking the veteran some questions, asking the caregiver some questions. Caregivers do get their own electronic health record in our system, and those caregivers are provided access to all of our education and supportive services, as well as system navigation assistance. Our general program does not provide financial compensation to caregivers, but again, it does provide for full access to our educational and support programming. Then we have our program of comprehensive assistance for family caregivers, or the comprehensive program, or PCAFC, or maybe the stipend program. This program is open to veterans who are 70 to 100% service connected as determined by the Veterans Benefits Administration. There is a strict application and assessment process, and there are specific clinical criteria that have to be met in order for the veteran and caregiver to be accepted into the program, and we're going to talk more about that as the slides go on. Caregivers who are accepted into the program of comprehensive assistance for family caregivers are paid a monthly stipend. A few things I want to note, just kind of off the top, big picture things. The VA's Caregiver Support Program is available to support caregivers who are caring for veterans. According to our national regulation, which was set at the federal level, this program is not available to veterans who may be caring for their non-veteran loved one. So again, the VA caregiver support programs are open to caregivers who are caring for veterans. If you are a veteran who is also caring for a veteran, that's great, and we would welcome you into the program. If you are a veteran who is caring for a non-veteran, unfortunately, you would not be eligible to receive services through the caregiver support program, but we would be happy to connect you to community resources that may be able to meet those needs. The other thing I really want to highlight here is that the Caregiver Support Program is designed to support existing family caregivers. The Caregiver Support Program does not provide caregivers to veterans. We do not hire caregivers on behalf of veterans. We are here to support existing family or friends who are serving as caregivers. You'll hear me as we talk about caregivers kind of referring to them as family caregivers. I want to be very clear that here at the VA, we are using the most generous definition of family possible. If family for you is the neighbor who takes you to all of your appointments and cooks you dinner every day and makes sure that you took your medication, that person would be welcome to enroll in whichever program was most appropriate based on your veteran status and their care needs. So I just want to make that very clear that although the terminology says family, we're really looking at that in the most general sense, but we are not here to support professional caregivers or provide professional caregivers. I would refer you back to the home health aid program that I talked about earlier if you are a veteran who is in need of a caregiver being provided to you. And we can go to the next slide. So caregivers, I show this slide mostly to highlight one thing, which is that both sides of our program offer robust education and supportive services, and we're going to get a little bit more in depth about what those supportive services are in the next few slides. And it's only until we get down to those last three things that are related to financial compensation where you see the difference between the two programs. I understand that financial compensation and money can help a lot of challenges that people face. I want to make sure it's clear, though, that the Caregiver Support Program is about more than just providing those financial stipends, and we have a significant focus on the educational and supportive services that we provide to caregivers on both sides of our program. Next slide. So I just wanted to touch a little bit more on the available education and supports. The Caregiver Support Program does provide something called SAVE training. It is a suicide prevention training. It helps caregivers recognize the signs that an individual may be struggling with suicidal thoughts, to learn to ask the most important and sometimes most challenging question, which is to ask if someone is having those thoughts about hurting themselves, to validate the answers that they receive from the veteran and feel comfortable responding, and then to encourage and expedite that person in getting assistance. SAFE training is available publicly 24 hours a day free of charge on the Psych Armor website, and then we offer it as a live class at least twice a year. Building better caregivers, as well as caregivers first, as well as resources for enhancing all caregivers' health, are all programs that provide a mix of general caregiver skills, so things like stress management, mood management, problem solving, asking for help, navigating resources are covered in all of those programs. Our Building Better Caregivers is online only, and it is an asynchronous learning environment. So that's great for caregivers who, may not have time to come to like a live scheduled event, or that doesn't work in their schedule, and they're just looking for something that they can sign into online as their schedule allows. Resources for enhancing all caregivers or Reach VA can be done individually or in a group. That provides, again, those general resources, the general caregiving skills, that mood management, stress management, problem solving, but then it also provides some more specific information about caring for veterans depending on their healthcare needs. So there is a specific curriculum for veterans who are living with dementia, for PTSD, for spinal cord injury, for MS, and then just recently a Parkinson's curriculum came out. And then there's also a curriculum, kind of an all eras curriculum available for anyone whose needs don't fit into one of those more specific categories. Again, that's available individually and through one-on-one coaching, as well as in a group setting. Caregiver health and well-being coaching is a program that we offer that is really focused on the caregiver as the individual. What is most important to them? What healthcare needs do they have that they're not addressing? When we talk about healthcare, we're really coming from the VA's whole health model, looking at the whole person. What is most important to their health and well-being? What areas of the circle of whole health are they looking to focus on? And then we help those caregivers set those specific goals and navigate any challenges or barriers that they may experience. We do have an annual caregiver celebration and resource fair that's happening this month, throughout the month. And then I did just want to mention Annie Caregiver Texting, which is a texting program the VA has that provides a mix of educational and supportive text messages to caregivers who are engaged. That also has some specific protocols that can be assigned around either stress management or mood management. There's also a protocol for folks who are caring for veterans with dementia, as well as a protocol for veterans who are caring for those with PTSD. Everything that's listed on here, caregivers do have to be enrolled in either our program of general caregiver support services or accepted into our comprehensive program. The exceptions to that would be that publicly available SAVE training that's linked here. And we can go to the next slide. So I want to talk a little bit more about the program of general caregiver support services. I'm not going to spend too much time on this, but we can go ahead and go to the next slide. So again, just to review, the veteran does have to be enrolled in VA healthcare services in order to access this. There is a program of general caregiver support services and a program of comprehensive assistance for caregivers, a program of comprehensive assistance for family caregivers program at every VA across the nation. This is a standardized program. So again, veterans have to be enrolled in their local VA healthcare system. The person who is interested in engaging with us as a caregiver has to be over the age of 18. The veteran has to agree with the caregiver enrolling. So the veteran is still the primary patient of the VA. So they do have to be aware and in agreement of the caregiver enrolling in PGCSS. Of course, if that veteran lacks decision-making capacity, we would defer to their healthcare agent. Caregivers do need to be open to providing us their demographic information, including date of birth and social security number, so that we can create their charts. And then again, the individual who's receiving care has to be a veteran. We can go to the next slide. All right, so this is where things start to get a little bit more complicated when we're talking about the Program of Comprehensive Assistance for Family Caregivers. Again, I'm going to go through a lot of information pretty quickly. There are a lot of things linked in this document that I know you guys will be able to see in the future, and then I know NAMI will also work to put together a fact sheet to send out. So please don't feel like you have to memorize everything I'm saying today. There's lots of resource information out there and available to you about everything that I'm going to share. So we can go to the next slide. Okay, so again, veterans, in order to be considered for PCAFC, veterans have to be 70 to 100% service connected or have at least one condition that's rated at 70% or higher in order to be considered for the program. Service connection alone is not enough to be accepted into PCAFC. You can go to the next question. So clinical need, the individual, so the veteran has to be in need of personal care services for at least a minimum of 6 months. So they need to have a continual need for 6 months based on the inability to perform an activity of daily living, the need for supervision, protection, or instruction based on symptoms or residuals from neurological or other impairments, or a need for extensive instruction or supervision without which the ability of the veteran to function in daily life would be seriously impaired. There is an eligibility fact sheet that is linked here, and we're going to talk about clinical eligibility a little bit more, but the highlight I really want to make here is that this is not designed to support veterans and caregivers where the caregiving need might be short-term after the veteran is recovering from an illness or injury. This is really meant to support those who are going to have long-term needs of at least 6 months or longer. And again, that clinical bar is set fairly high. The individual does have to require either physical assistance with their activities of daily living or extensive assistance in the areas of supervision, instruction, and protection in order to be accepted. We will spend just a few minutes talking about each one of those things a little bit more. I want to make sure we have enough time for questions. We can go to the next slide. Okay, so this slide, again, it provides a little bit more explanation about what we mean by the inability to perform an activity of daily living. The regulation states that the veteran has to require assistance each time at least one activity of daily living is performed. And when we're talking about daily living or activities of daily living, we're talking about dressing or undressing, bathing, grooming, adjusting or putting on prosthetic or orthopedic devices, toileting or attending to toileting, feeding oneself, but I want to highlight here and be very specific that feeding oneself is the criteria. That does not extend to if someone needs assistance with grocery shopping, meal preparation, or cooking. The activity of daily living that is being evaluated here is feeding oneself. Or the ability to address their nutritional needs if they are not able to, if they get their nutrition through non-oral means. And that the last criteria is around mobility or walking. So we recognize that not all activities of daily living are performed every day, but every time that activity of daily living is performed, the veteran has to require assistance. We're going to go to the next slide. So this provides a little bit more information about that supervision, protection, or instruction. They give some examples. Again, here we're really looking at, would there be a safety concern if there was not a caregiver present? So a veteran with dementia who may be capable of washing their hands or taking a bath, but would need assistance making sure they're using the right water temperature and might need step-by-step cueing instructions in order to complete those tasks. The other example they give is a veteran who's living with schizophrenia who might be experiencing active delusional thoughts that lead to unsafe behavior and may need another individual to provide supervision or instruction to ensure their safety. Next slide. So again, and then there is some additional criteria around it being in the best interest of the individual to participate, that person is agreeing to receive care from their caregiver, and that they will engage with VA healthcare, VA primary care if they are accepted. And we can go to the next slide. Again, over the age of 18, lots of these are things that we've already talked about. So we're going to go to the next slide in favor of just quickly talking about the application. So there is a required application and assessment process. I've linked the application fact sheet and the website. You can apply online or by paper, but the thing I want to highlight is the next slide, actually. So if we can go to the next slide. So this shows what the application process looks like. So submitting that application is just the very first step, and then it kicks off all of these next steps. So there will be a veteran assessment completed, a veteran caregiver assessment completed, and then a veteran functional assessment completed with a clinical assessor. The applications are reviewed by our centralized eligibility and appeals team. If caregivers get that initial approval, they do have to complete a caregiver training and home care assessment before final approval is given. The goal is to provide an eligibility decision within 90 days of receiving an application. And we can do the next slide, which I think just has some tips. So this slide just provides some information about the monthly stipends. That's based on the GS pay scale, which is the pay scale used by the Office of Personnel Management for most federal positions. So some additional information about that here. And we can go to the next slide. I do want to note that approval into PCAFC may impact the ability for a veteran to access services like our home health aid service or our veteran directed care services. Veterans and caregivers will be told how those services will be impacted before any change happens. They will always be given the opportunity to make an informed decision. Next slide. If folks are denied from PCAFC, they absolutely have the ability to appeal. There are several appeal options, and there are additional details and even a video on the Caregiver Support Program website that has more information about denials. So we can go to the next slide. And then just some contact information for us. You have the Maryland local phone numbers. You can find the contact information for offices across the state on our website. So I've linked that information. The caregiver support line is an excellent phone number to call if you are a caregiver who is interested in getting connected, but you're not sure where to start. If you live in Maryland, if you live in Kentucky, if you live in Montana, if you live in California, you can call the caregiver support line. You'll talk to VA Caregiver Support Program staff, and then those staff will send a report to your local Caregiver Support Program office, and you should receive a call back from that office within 5 business days. So it's an excellent resource for those who are looking to get connected to the Caregiver Support Program, particularly if you're living out of state and I didn't have your local office's contact information listed in this presentation. Then next. All right, I think that is it. I got so close. I'm only 2 minutes over. So happy to answer any questions that have come up or revisit any of the questions that I was sent in advance that I didn't hit on.
Hilary, thank you so much for providing this critical information during this great time of need. We would like to open up the webinar now for any questions that you may have. Remember that you will stay muted to avoid background noise, but you can type your question into the question box at the right-hand side of the screen if viewing from a computer, or at the bottom of the screen if viewing from a phone. If you have a question that you'd like to ask, or if you have a comment about the webinar today, please enter these in the question box now. If we do not have time to answer each question today, we will provide our contact information at the end of the webinar or anyone who may wish to reach us. So I know we have the questions that we had prior. I don't see any yet
Okay.
that's listed.
I
So
I have those questions in front of me, so I can just try to go through them until you tell me that someone's asked another one. Does that work?
okay, all right, yes.
All right. So someone had asked about community organizations hosting caregiver meetings. If you are a part of a community organization that would be interested in working with your local caregiver support program, I suggest you just get in contact with that office. If you're local here to Maryland, that would likely mean connecting with me. If you're not local to Maryland, I would suggest you contact your local office to talk about how that could happen. The Caregiver Support Program is absolutely not limited to the VA Maryland's healthcare system. Again, this is a national program. It is at every VA across the country. We talked about the criteria that has to be met for our Caregiver Support Program, as well as our home health aid program. Someone had asked a question about intermittent caregiver benefits for folks at home. I hope I have answered those questions, or at least clarified kind of the ways in which the VA can provide in-home support or support to the caregiver. Someone had asked if there's any support.
Sorry,
Is
there's
there
another
another question?
Yeah, it says, will the desk be made, will be deck be made available to participants? I think this resource will help my organization navigate the VA services.
So my understanding in my conversation with NAMI is that the deck itself is not going to be shared, but that a resource document is going to be created with the links from the deck. And certainly I'm happy to talk to NAMI offline and follow up.
Have you lost her?
Yeah, it seems like it.
Oh no.
I know.
Okay, well, let's give it a minute. Maybe she will come back.
Yes.
Meanwhile, if audience members have any more questions, please feel free to put them in the chat box. We
I
will
might
be
be here. Am I
definitely
back?
Okay, your video is still stuck, but we can hear you.
Okay.
Here you are.
Oh, here you are.
Okay.
Here you are. Okay.
Woo, we made it almost all the way to the end. Okay. So I'm happy to talk to NAMI offline about kind of what information will be dispersed to the public. Was there another question, or should I try to hit a couple more from the list I have?
There's another one that says, what about the surviving spouse? Are there any benefits in the caregiver program?
So the Caregiver Support Program itself does not have services or benefits available to surviving spouses. There are some financial benefits that are available to surviving spouses. That is based on kind of that individual veteran's time in the.
Uh-oh.
Oh no.
Yeah,
Oh,
she's gone again.
am I here? I'm sorry.
You're back.
I wish I could fix it. I think anything I might do to fix it might just make it worse. So surviving spouses, not through the Caregiver Support Program, but possibly there are pension benefits available for some surviving spouses, and then like survivors benefits. So again, I would refer people to the veteran service organizations who can assist them with navigating the VBA system for that.
Okay, so we're at the end here, Hilary, and would you like to give people your information on how to contact you if they have more questions?
So I would strongly suggest that folks utilize the contact information that's been shared throughout the program for our office. I will say people are welcome to contact me, but I am one individual who is right in the middle of National Family Caregiver Month and booked back to back with events and programming. I'm happy to give my email address. I will not be I can't respond with personal health information in there, but if you would like for me to give you a call or connect, I'm happy to do that. It's Hilary, HILARY Wiseman, WISEMAN, the number 2 at va.gov. Again, or I would suggest you contact your local caregiver support program, the caregiver support line, if you are in need of additional assistance, or you're welcome to email me, and I'm happy to do my best to connect you, as long as we all can give each other some grace and understanding that it is a busy time right before a holiday. So, yeah.
All right, so thank you everyone for joining us this afternoon, and thank you to Hilary and Gertie for joining us. As a reminder that the webinar will be recorded and emailed to all the registrants soon. And for any other webinars that will be coming up, please don't forget to register for them on our website. That's at www.namimd.org. And we will be, as said before, uploading this onto our website as well. And we hope that this webinar has been helpful to you this afternoon. At the end of the webinar today, there is a short survey that we ask you to fulfill, and that would help us determine how NAMI Maryland can help best support you at this time. And if you would like us to continue our work and build better lives for the millions of Marylanders coping with mental health conditions, please consider donating to our Giving Tuesday campaign. With your help, we can reach the goal of $25,000 to help advocate for comprehensive, equitable policies, grow new and existing outreach projects, and increase and enhance on-site and virtual programs. We wish you all a safe and healthy rest of your week. Please do not hesitate to reach out to us through our website or by our phone at 410-884-8691 should you need any additional resources or support. Have a great rest of your day. Thank you.
Thank you. Thank you so much.
Thank you.
Thank you
all
Bye.
veterans.
Yes, absolutely. Thank you. Bye-bye.
Bye-bye.